I am Mary Ann Wong Cordero, biology professor, teaching genetics at the Department of Basic Science of the College of Medicine at Princess Noor bint Abdul Rahman University in Saudi Arabia. My colleague, Dr. Amal Alutaibi, and I conducted a study on assessing medical students' knowledge of genetics, basis for improving genetics curriculum for future clinical practice. We conducted this study to evaluate medical students' knowledge of genetics. Results were used to identify the gaps in students' knowledge of genetics and served as basis for improvement of the current genetics curriculum of our Bachelor of Medicine and Surgery program. The genetics knowledge of medical students was assessed using 65-item multiple-choice questions and self-assessment survey questionnaire. The MCQs were validated and tested for their reliability. Exam results showed insufficient knowledge of genetics, with only 43.85% among the students answering the exam correctly. In self-assessment, the majority, which is 83.3 to 87.8% of the respondents, considered their knowledge of genetics insufficient for future clinical practice. A higher knowledge level of basic genetics compared with clinically related genetic concepts was observed. Generally, second-year students significantly scored higher in molecular and cytogenetics, principles of genetic transmission, and inheritance of genetic diseases, compared with the fourth-year medical students who only scored higher in items related to cancer genetics. In conclusion, medical students' knowledge of genetics is not sufficient. Fourth-year medical students do not retain genetics knowledge. Based on the findings of the current study, it is imperative to strengthen the genetics curriculum content of our MBBS program and increase contact hours for lectures and skills development. There's also a need to incorporate medical genetics throughout the 4 years of the medical curriculum and to design and implement appropriate teaching and assessment strategies. We would like to note that there is an ongoing effort to collect direct feedback from medical students and genetics educators on the difficulties they have faced relevant to genetics knowledge in clinical practice. We also look forward to having linkage with the researches related to genomic medicine, as well as on the different genetic services within the kingdom, like the Saudi Human Genome Program, the largest genome initiative in the Middle East, which aims to reduce and prevent genetic diseases.